Dr. Molly again. I'm a professor at the University of Detroit Mercy in the College of Health Professions. I'm also one of the co-founders of Associates in Primary Care. One thing that we are trying to do is increase knowledge and patient education because we believe that if patients can understand their medical conditions, they're better able to manage those conditions. So it is the second in the diabetes, type 2 diabetes series. And this video is going to focus on the symptoms. How do you know if you have type 2 diabetes? Type 2 diabetes, unlike type 1, can take years to develop. And some of the symptoms of type 2 diabetes are what we call insidious. Um, they may have developed over time, and so they become normal for you, or you don't recognize them as being abnormal. But some things, for example, non-healing wounds, frequency of infections, frequency of urination, excessively hungry, losing weight, unexplained weight, that you like not that you're dieting, you just unexplained weight loss, fatigue, general fatigue and malaise. Blurred vision is a big one, because as the sugar builds up in the eyeballs, that you start having to look through. Basically, you're looking through sugar. It's too much sugar, so you can get blurred vision. Numbness and tingling in the hands and feet. Nerves don't like sugar. So your nerves are like a little piece of thread, like sewing thread, comes out of your brain and down through the vertebrae in your spine. They're very sensitive to sugar. So when the glucose and sugar, it means the same thing. When your sugar gets too high, it starts destroying some of those nerves, which is why as diabetics have uncontrolled diabetes for too long, they can lose their vision because the retinal nerves that go to your eye start breaking down. It can cause blindness. It can cause numbness and tingling in patients' feet. And so then if you step on something or injure your foot and you don't know it because you can't feel it, then that gets infected. That's how a lot of our diabetics lose limbs. So numbness and tingling is a big symptom of type 2 diabetes. So if you're starting to develop any one of these things that I just talked about, you might need to go get checked out by your primary care provider.